If you manage to get through life without spraining your ankle, well, congratulations. But for the rest of us, we know just how painful and debilitating that injury can be. But did you know that you can also sprain your tooth? Let's talk about it in today's video. Well, hello again, folks, and welcome back to another Dentistry Made Simple video. My name is Dr. Kenneth Goods, and I'm a retired dentist from the state of South Carolina here in the U.S. So when you sprain your ankle, or any joint for that matter, typically by rolling it in an awkward direction, you end up stretching, or more likely tearing, the ligaments that surround that joint. It's very painful, requires you to stay off or stop using that joint, and allowing your body the time it needs to heal and repair itself. Spraining your tooth is actually quite similar. We all have tiny little ligaments that connect our teeth to our jawbones. Therefore, spraining your tooth, or sprained tooth syndrome as it is commonly called, is defined by strong forces on your tooth that cause those ligaments to become stretched and chronically inflamed, causing pain, often described by patients as a generalized ache, gum itchiness, soreness upon chewing, sensitivity to temperatures, and the occasional headache. Spraining your tooth, however, can cause a lot of difficulty for your dentist because that resulting pain is very similar to a host of other dental issues, so it becomes very tricky to diagnose and treat properly, sometimes resulting in delayed treatment or unnecessary procedures or excessive trauma on that tooth. It's a very frustrating situation for both the patient and the dentist. So let's go over a few common causes that could lead to a sprained tooth. Number one, sinus problems, allergies, or colds. With all three of these issues, you'll likely end up with sinus drainage buildup that can cause pressure to increase around our teeth, causing them to move ever so slightly. But that's all it takes to alter your bite, just enough that one or two of your teeth end up taking on more biting pressure than before, and those ligaments get overworked, leading to a sprained tooth. Number two, accidental trauma or trauma from a small object. This was the most common explanation for a sprained tooth when I was practicing. You bit down on something that you didn't know had seeds or nuts or a bone in it, something like that, and man, that hurts. Once again, those ligaments take a beating, and you have yourself a sprained tooth. Number three, dentistry. Yep, you heard me. Sometimes dental work is the culprit. If you've ever had a crown or a filling placed in your mouth, you'll likely remember your dentist checking your bite by having you bite down and slide side to side on thin paper, which makes marks on your teeth so we can see where there may be too much rubbing. If we don't even out your bite well enough, this can lead to issues. It's rare, but it can happen. Our bad. Number four, an infected tooth. Sometimes a bad infection can literally lift up the tooth slightly, which can easily lead to a bite that is not in balance. Typically, once you treat the infection, the problem goes away, but symptoms from a sprained tooth might linger. And lastly is number five, an imbalance in your bite. Now, I won't get into too much detail here as this is dentistry made simple after all, but your front teeth are made for tearing and your back teeth are made for grinding. Now, if those roles get reversed for any reason, then our teeth become very unhappy because they're being forced to take on a role that they weren't built for. In a short period of time, you'll have a sprained tooth. So as I mentioned near the beginning of this video, spraining your tooth is easier than you might think, but successfully treating this condition is tricky. You'll need to be patient with your dentist as they work through the various treatment options meticulously. If there's an obvious problem, such as an infection or broken tooth, then they'll need to treat that first. However, if the discomfort continues, then they'll need to work slowly and methodically in an attempt to discover where these stresses and strains on the tooth are coming from. They can't rush through this because they can end up making the problem even worse. It may only take 4 to 5 days to get relief, or it may take 4 to 5 weeks. So hang in there. Deal? Well, let's wrap up today's video, folks. I hope you learned something that you didn't know before. If you enjoyed this video, would you do me the favor of hitting that like button below, as it will help this channel grow? Feel free to leave a comment or question as well. Please consider subscribing. Be sure to hit that bell icon so you can be notified of future videos on dentistry made simple. Bye-bye.